It's Tuesday, the 2nd of February 2016. I'm Russ McLean, Chairman of the Patient Voices Group, and today I'm talking with the Chief Executive of East Lancashire Hospitals Trust, Mr. Kevin Mcgee. Now, for the purposes of our recording, what you're about to hear is unedited and unscripted, and Mr. Mcgee has no previous knowledge of the questions I'm about to put to him. The Patient Voice Group works very closely with the Trust on behalf of the patients it represents, but we can't take on board individual complaints against the Trust. There are procedures for doing just that. What we can and continue to do is to have conversations with the Trust and its board about issues which might affect patients and staff generally. It's one of those issues I'd like to begin with today. Kevin, hello first of all.
Hello.
A number of months ago, the Trust decided to move the fracture clinic services from Burnley to Blackburn, a decision which seems to be quite unpopular with some patients. Kevin, can we begin by reminding our listeners about the rationale for that decision and what it was hoped to achieve by the move?
So this was a clinically led decision, so that the clinicians within the Trust were coming to us and saying, look, we can't staff the service safely going forward, so we need to try and consolidate. It was also a clinic that was only run every couple of weeks and very few patients who were actually attending the clinic. So we felt for clinical reasons it was better to centralise the service on one site at Blackburn.
Now, of course, you've apologised in the past for not involving people and patient groups in particular for that decision. But on Friday, the 20th of November, there was a joint Blackburn with Darwen and Lancashire Health Watch inspection at the Royal Blackburn Hospital. Now, Health Watch have spoken to 16 patients and gathered their views. A number of patient groups in the area, though, have raised concerns about that inspection. And I'd like to read to you, if I may, a letter which I addressed to the Trust Board last week. Dear ELHT Board, I write with some concerns I have following a recent visit by Health Watch Blackburn with Darwen and Health Watch Lancashire. I understand that on Friday the 20th of November 2015, between the hours of 10 to 12 p.m, the above-named organisations carried out a joint enter and view inspection of the fracture clinic at the Royal Blackburn Hospital. Now, it's been brought to my attention that fracture clinics at the Royal Blackburn run from Mondays to Thursdays, and that the clinic on Friday is the orthopaedic clinic, which sees patients pre- and post-operatively. It's also been suggested that Health Watch did not visit a fracture clinic. Could you please clarify for me, prior to me contacting Health Watch, that the clinic they inspected was indeed the orthopaedic clinic and not the general fracture clinic? Would the board give the Patient Voices Group assurances that the recommendations contained within Health Watch report will be acted upon in a timely manner and that patients will be adequately informed and engaged regarding the future of the fracture clinic? First of all, can you tell me, have you seen the letter? I'm guessing that you have, and are you able to comment on the concerns that I've raised with you?
So I have looked at the letter. I mean, let's be clear, Health Watch are completely separate to East Lancs Hospitals Trust. They have the right, and we welcome them to come into the organisation at any time and to review any service. And that's exactly what they did. So we have no control over what they do, how they do it, and we welcome them into the organisation. I personally don't know exactly the details of the review that they undertook because it's their review, it's not my review. What I will do is endeavour to have a conversation with Health Watch to understand what the findings were and where they undertook or where they gathered their evidence for those findings.
Well, I can tell you that of the 16 patients they interviewed, 5 of those patients were from Blackburn with Darwen. There were one each of patients from Accrington, Hyndburn, Oswald, Twizel, Padgham and Wiltshire. There were 2 each from Rawtenstall, Haslingden, Darwen and Burnley. And 12 of the patients travelled by car. The report is quite in-depth, it's available online and very interesting, although I would perhaps say that the sample size was quite small. I suppose that's something we should discuss with Health Watch. Are you able to share with me approximately how many patients are seen in an average fracture clinic?
Well, clearly it can vary significantly. So we were only having very small numbers of patients, in the 2s and 3s who would attend some of the clinics on the Burnley site. Through the Blackburn site, it really is. It's unfair really to say a particular number because it can vary so significantly. But I do accept that the clinics on the Blackburn site are very busy clinics and are very heavily used clinics. What we're looking to do is we continually review capacity through our outpatients and through the clinics and through fracture clinics, and if there would be a need to put on more capacity, I'm not averse to that. So I wouldn't like to give you a number. That's not backing down, it's just that it can vary so much. It's simply saying that we will review it, we'll continue to review it, and if there's a need to put capacity in the system, we will always look at that.
Can I ask the question again? It was a question that was written in by a member of the public. Did Healthwatch inspect an orthopaedic clinic or a fracture clinic?
Okay, so again, I'll go back to what I said before. This is not my review, it's Healthwatch's review. They have to have complete independence and they can go anywhere. I will certainly raise that question with Healthwatch and ask them to clarify where they undertook their review.
Are there any plans to move the fracture clinic back to Burnley? I know that you personally take all concerns very seriously, but what would you say to those patients and members of the public who perhaps fear that this is the beginning of a transfer of services from Burnley to Blackburn, which has been said to me?
So what we always have to do is to look at what's the best way to deliver health services right across East Lancashire within the resources that we've got and the resources of money and staffing. And we always have to do what's right from a clinical safety perspective for the residents of East Lancashire. So actually we're looking to improve services, not reduce services, but that doesn't mean that services will remain the same going forward. So if you look at what we're doing on the Burnley site, we're looking over the next year or so to invest an additional £16 million in a new state-of-the-art service that will bring ophthalmic services with maxillofacial services and a new outpatient services, and we'll tidy up the Burnley site in terms of some of the poor accommodation that's on that site. So that's a great investment in services. It will mean that if like how we deliver services and where we deliver services will change. And I have to say it will continually change going forward. There's changes in medical technology, there's staffing issues, and we always have to do what's right based upon clinical safety and in trying to improve outcomes.
I'd like to stay with the subject of appointments if we can and talk about the forthcoming junior doctors' strike next Wednesday, which will be the 10th of February. I know we've spoken previously about how the Trust works very hard to minimise the effects that the strike will have on patients, but tell me how you achieve that.
So we've just been notified this week that the next strike will go ahead. I can't say I'm hopeful. There is still an outside possibility that they'll reach some type of compromise, but at this point we have to assume that the strike's going to go ahead, and it's now a 24-hour strike. So it'll start on the Wednesday morning at 8 o'clock and go right the way through to 8 o'clock on the Thursday morning. The good thing about it, if there is a good thing, is that the juniors are still going to provide emergency cover. So anybody who needs emergency services will be seen in the normal way. What we are going to have to plan on, though, is standing down some elective work and some outpatient work. So what we're currently doing is going through all of our clinics, all of our elective lists, it's the planned activity, and looking at which we think can be stopped safely. Clearly, once we've done that, all patients will be notified, and patients will be very clear why we're doing it and what the impact will be. So we're currently in that planning phase. And all patients will be notified accordingly.
So if patients are a little confused about if they've got an elective surgery coming up or they've got an outpatient appointment, what in fact should they do?
So if they can contact the hospital, but we will be contacting them. So we'll be writing, we will be getting messages out through various forums to the patients. But if you are worried, you can phone the hospital and we can talk you through what's going to happen.
Let's talk numbers. Are you aware of how many sort of junior doctors the Trust employs?
So we have, it varies because a lot of the junior doctors are on training grade, so it can vary at any one time depending how many junior doctors are in the organisation going through training process, but between 300 to 400.
What sort of effect does a strike like that have on staff morale? So not just talking about the junior doctors, but the rest of the staff as well, because it must put additional pressures upon them.
I mean, it does. We are very lucky, I think, within East Lancashire. We've got some brilliant doctors who are training in the organisation, junior doctors, like that middle tier, below consultant level. And we're very fortunate to have our junior doctors. We're very supportive of them, and we give a good training environment, and they give an awful lot back to the organisation. So I think everybody is sad when it gets to the point where nationally agreement can't be reached on a suitable contract for junior doctors, and it's felt that the only way forward is to go through this strike. It does impact on other staff. I mean, when we had the last strike, all our senior consultants were on site. Any leave was stepped down, any training and study was stepped down. So we had really good coverage from senior staff, and we'll have the same again this time. But it does undoubtedly put extra pressure on staff, and we just have to be aware of that, and we try and support staff as best we possibly can.
Have you had the results back yet from the National Staff Survey?
So we've not had the formal results back. That, I think, is going to happen towards the back end of February. But we've had some initial indications. Actually, it's a really positive response, and staff morale in the organisation, staff engagement in the organisation is improving. So that's really, really positive. And I think that's really important at this time of year, because I have to say our staff are brilliant. This time of year they're working incredibly hard, incredibly long hours, lots of poorly patients in all of our services. And it does take the pressure, and it does take its toll on staff. So please be aware of the pressure that staff are under. They are incredibly dedicated, incredibly professional in what they do, but they are under immense pressure.
Well, I want to talk about staff a little bit later on, but let's move on to your executive team. You recently moved to level 2 within the main hospital from what was, I think it was, the primary care centre. Why the move, and what will now happen to that building?
So one of the things that staff were saying in terms of engagement is where we were on the site in Blackburn, it was very isolated. And you can get comments about ivory towers and the rest of it. I think it's really important that as a board, and particularly as an executive team, we are highly visible, and we're in the organisation right there with everybody else. So clearly I am not a clinician, so I can't be on the front line, but I need to be highly visible, and therefore moving the Trust HQ onto the main site where we walk the corridors every day, we're visible, people can drop in and see us, and we're much more accessible to clinicians, to staff of all disciplines across the organisation. I think it's really important, and it's a really important statement that we are here and we need to support the organisation in all that it does.
We've spoken previously, and in fact just a moment ago, about the new Ophthalmic Units, which is a step closer to fruition in Burnley. Can you explain more about that unit and the processes involved in making your proposals a reality?
So we've done a lot of work, and we've had a lot of support from the ex-MP in Burnley, Gordon Birtwistle, in terms of trying to get access to funds to build a new unit on the Burnley site. We're now working through all of the practical documentation that's going to be complete, but it's been confirmed that the money is available to us and will be allocated to us over the next year or so to make that build. So what we're looking to do is basically allow us to tidy up the Burnley site. The Burnley site's got some brilliant first-rate services and facilities, but it's also got some old accommodation. This will allow us to get rid of the old accommodation, and what we'll have is a state-of-the-art outpatient unit, and we will bring together ophthalmic services and maxillofacial services. And it's my aspiration on that site that we develop, in terms of ophthalmic and maxillofacial services, not just a regional service, but actually a national centre of excellence. And that will be, really put East Lancs Hospitals Trust and the services that we deliver on the site on the map. I think it's really important that we have the highest aspirations for the best possible services for our population. And I'm looking on that site, in those services, to have a national centre of excellence.
It's no secret, of course, that the trust, like every trust in the country at the moment, is in a financial deficit. How are you able to therefore carry on investing in both buildings and staff? How are you able to do that?
So, you are right. We do currently have a financial deficit. We've got plans, and we're working very, very hard to try and reduce that deficit and to get back into recurrent financial balance. But I think it's really important that even when we've got such a difficult financial situation, we don't stop, and we continue to do the right things in terms of investment where it's necessary, both in terms of staffing and in services and in buildings, and we are committed to doing that. Now, that's not to say that we don't need to get ourselves back into financial balance, and we do. And, we will continually have to look at how and where services are provided, not just across East Lancashire, but also across wider Lancashire. So there's conversations going on now across the wider Lancashire footprint about where services should be located and how they should be located. My objective within that is to make sure that East Lancashire is as efficient as it possibly can be, and it's producing the best possible services to put us in the strongest place to have those conversations with partners across Lancashire, because I think it's really important that we maintain a really strong portfolio of services in East Lancashire.
Kevin, I've had a question in from a member of the public who seems to be a little confused, I think. They wanted to know about your new Assistant Chief Exec. Can you throw any light on that?
So the post is assistant to the chief exec, and it's a post really just to provide some support in terms of keeping on top of the queries and the questions and the issues that come across my diary and come across my desk. So it's basically a support for me into to help deliver services across East Lancashire.
Now, although so far winter has been very kind to us and we've been spared the cold spells we usually experience, your emergency department continues to be very busy. In fact, so busy that you were forced to divert patients recently. Now, that sounds like a very drastic course of action. Why would something like that have to happen?
So what we're seeing on a national basis, and we're no different, is over the last 3 weeks or so, there's been a big increase in numbers of people attending A&E departments, and there seems to be lots of reasons for this, but one of the things that I think seems to be happening is that there has been a spike in patients attending with respiratory problems, perhaps related to flu-like symptoms, and I think that's probably a consequence of the weather. So what we've not had is a really, although we've had some cold snaps, it's mainly been quite warm, and so what we've not had is a period where, if you like, in my layman's terms, and this is layman's terms, the bugs have been killed off, and that's not been the case because we've not had any significant cold snaps. But what we have had is an oscillation between, relatively warm weather and cold weather, and that's not been great, and I think that's caused a lot of people with respiratory problems, flu-like symptoms, and there has been a rise both within East Lancashire but also nationally.
Now, you seem to be sending out some very strong messages to our local communities about the appropriate use of the ED or A&E. Are these messages getting through, do you think? And what can patients do to ensure that your departments aren't overwhelmed?
I think that this is a really important question, because you alluded to the fact that we have had to divert, and when numbers become so great in the department that we physically don't have the capacity to actually see any more patients, we do ask for a divert. Now, it doesn't happen very often at all, and basically what we ask there is for the ambulance service, if they can, to, instead of conveying patients through to Blackburn, to look at where they can go elsewhere. Now, I have to say it's been so busy across the whole of the country, and particularly across Lancashire and Greater Manchester, there's not been anywhere else for patients to go, so patients have still come through to us. But all we're asking, clearly, if you need to come to an A&E department, you will always be seen. But there are other courses of action. So, pharmacists in the first instance are a very good source of treatment.
Well, let me interrupt you there, because I've sat in your A&E on numerous occasions and watched as patients arrive with minor illness and injury that could perhaps be treated at a minor injuries unit or in a GP setting, or sometimes even by self-care, the simple act of putting a plaster on it, of course. Is it frustrating for you and for your staff when patients arrive as a result of neither accident nor emergency? And what can we, as a society, do to better educate patients on the appropriate use of health services?
Well, I think a conversation such as this is really important, because we need to get the messages out in any way we possibly can to our communities to really think about the services that we offer. I mean, our A&E services are some of the best in the world, and they are very precious, but we shouldn't abuse them. And we should only really think about coming if it's absolutely necessary. And as I said, if people turn up, we will always see them and always treat them. But just think before coming, is there a better way? I just know from a personal perspective, rather than spend 4 or 5 hours in an ED department, if there's another way by going to a pharmacist or if I can get a GP appointment, I would rather go through that route than turning up in ED.
There's always something else, and of course, if you're in doubt, please call 111. Let's talk about great news. The Trust is doing some amazing work for communities abroad in the third world settings where equipment is in extremely short supply. Now, 2 of those projects which immediately spring to my mind are the donation of mortuary equipment and some hospital beds. Can you explain to me and the public how this came about and what these donations mean to those communities?
So we recognise that we have, as well as the responsibilities locally, we have a wider corporate social responsibility. So we have very strict health and safety regulations with the equipment that we use, and when it gets to a certain lifespan, that equipment, we have to replace that equipment. But that doesn't mean that there's not still a working life for some of it. So we do link in with other parts of the world. We do try and transfer as much kit that's still got some use to perhaps less developed parts of the world. It's something that we are very proud of, and we would always look to think before we condemn or get rid of any valuable medical equipment. Can it be used elsewhere? Is there more life that can be given from this equipment? So that's what we do. We are proud of it. We're always looking for opportunities to link in with other countries and other parts of the world. We're currently thinking about whether we can do some work with Nicaragua, for instance. It's in its very early stages, but there are lots of programs that we're involved of, Nicaragua being one.
Congratulations on that. Now, this is a very personal observation. You seem to me to be a very hands-on chief exec, and you've got a strong reliance on the use of social media to endorse some of your messages. It might surprise some people to learn that you produce a weekly blog or online diary for those people that haven't quite grasped the term blog. Why do you think it's important for you personally to share your thoughts in that way?
We employ 7,500 staff. We cover a massive geographical area. We serve communities that are about 550,000 people. So we have to use every media possible to be able to talk to staff, to be visible, to get messages out. So going on television, doing blogs, speaking through radio, doing sessions such as this, something I'm not particularly comfortable with, but it's a part of the job, and it's an important part of the job to be visible and to get messages out. So it's something that you've always got to do. And
all fair play to you. You do it very well, and I think you are getting those messages out there. Let's talk some more good news. In March, the Trust will be holding another Star Awards to celebrate the staff. Can you tell me more about the awards, how winners are selected, and why you think it's important to acknowledge the staff in that way?
So we are absolutely only as good as the staff that work for us, and engaged staff, motivated staff deliver better clinical care. That's it, full stop. Every member of staff, regardless of whether they are frontline staff, whether they provide support services, or whether they work in office in the backroom functions, also contribute to delivery of care to our patients and our communities. And it's important that we recognise that the work staff do right across the board. So the Star Awards, they happen every year. The different categories, so there's Clinical Champion of the Year, there's Researcher of the Year, there's lots of different awards that we have. I might have got the category slightly wrong in terms of the names, but you get the point. There's lots of different categories that we have. Different people can nominate, so staff can nominate colleagues. We have Governor Awards where governors nominate people, stakeholders nominate staff for going that extra mile. And they are quite joyous occasions. So I've only been to one of our staff awards. It was my first one last year in April period, and it was a brilliant evening. And it's just nice. Sometimes it's difficult to recognise on a day-to-day basis when you're so busy the extra work that staff does. So just taking time out one evening in the year just to have a nice evening and actually recognise the additional effort the staff do, it's so important, and I think it's really important for staff morale.
Kevin, you've been in post just over a year. Tell me about an average day in the life of Kevin Mcgee, the Chief Executive.
Oh gosh, I wish there was an average day to start with, because literally every day is different. I have to say, and again, people might smile or whatever at this statement, but whenever I go anywhere, particularly externally, and I introduce myself, I always say it's a privilege and an honour to be the Chief Executive of East Lancs Hospitals Trust, and it is, because the communities that we serve are first rate, and the services that we deliver, we may not always get everything right every time, but I can absolutely guarantee you we do try and get things right. And the people, our doctors, our nurses, our porters, our physios, our caterers, our finance guys, whoever they are really dedicated to doing the best thing that they do. So my job is about trying to do the best for our services, and then do the best for our population. I have to say the hours are really long. My day would normally start somewhere just before 8 o'clock, and it can go on to to whatever time in the evening, because there's quite a lot of evening meetings. I'm always on the phone. If there's anything that goes on in the organisation, I speak to directors, I speak to senior clinical leaders, and that can be any time. It can be 24/7, anytime at the weekends. So there's no sort of typical day, but the hours are long. There's a lot of national pressure coming on in terms of performance around money and around targets. There's also lots of debates going on currently, and a lot of my time is spent up talking about what's going to happen across Lancashire and how services are going to be configured across Lancashire going forward. But my job ultimately is to do the best for the services in East Lancashire, and hence the population of East Lancashire.
Kevin Mcgee, Chief Executive of East Lancashire Hospitals Trust, thank you very much for your time. Remember that you can submit a question for me to put to the Chief Executive by contacting the email address below, or by calling 01254 752 130. That's 01254 752 130. But please remember that the patient voice group is unable to enter into a discussion with the Trust about individual complaints. I'm Russ McClay, and wherever your journey of life takes you, have a safe trip.